Good morning, everyone. This is the presentation on the 2023 Medicare. Joe Murphy is a Glenwood resident and a specialist in Medicare. He's been a certified agent broker for 23 years, specializing in Medicare, and he's going to give us a presentation on decisions, pricing, that kind of thing. And then Joe is available for complimentary private sessions at any time. And Joe Murphy is in the book under Glenwood. So Joe, there you go.
Okay. All right. I'm going to start. And there we are with a good morning. And let's see, anything important here? Yes, I am licensed. That's really important. I'm learning that people will make phone calls to these television advertised telephone number, call now, and you're not talking to a licensed broker invariably, and that's illegal, but that they seem to get away with it. But I am licensed, been licensed for a long time. Let me get rid of these up here. See if I can, open my screen up for me. Okay, and at the bottom, my consultation services are free because I am compensated by a successful insurance company. If we write some business, that's the term, writing business. If I do some business, the insurance company that is successful pays me a commission. So I'm happy to consult, give quotations, and discuss. Okay. So today's objective is to help you recognize the Medicare insurance solution that will have the most favorable medical outcome, and that could be plural because life is long, hopefully, and we have we have more than one occasion for a medical decision and the like, and then secondly, at the lowest total annual cost. So these are tied together, but my first endeavor is to address quality of care. And so I'll spend a good bit of time addressing the quality of care in the different solutions. And then we'll certainly add in the financial exposure piece. So this is from the center, CMS. You'll see me refer to that occasionally. It's the Center for Medicare and Medicaid Services. CMS is, you might say, the top of the food chain. They really are the boss. And from them, they have this data. And, we have 65-year-olds here in Hershey's Mill. But according to Carl, you mentioned Carl Grants. I see Carl, he's my village neighbor. He's saying that the median age is approximately 75. So, I know some 80-year-olds and 85-year-olds, but I know some, I think, 50-year-olds as well. But anyhow, this is important data that you can't get away from. At age 65, most of us have one chronic condition. At 75, we have two. This is, again, statistics. These are what CMS, has confirmed. At age 85, most have three or more chronic conditions. And what are those chronic conditions? These are the biggies. 58% have high blood pressure. So you can read that list, and I think you'll recognize many of those conditions. And that's for real. So that's really, I think, a snapshot of Hershey's Mill people. Go by the age, and they have one chronic condition or two or three. Okay, so that's, can't get away from it. Okay, now Medicare eligibility is something we have to be. We have to have the eligibility. We have to have our Part A and our Part B, Medicare Part A and Medicare Part B. You're familiar with the red, white, and blue card. Some will just have the Part A in place at this time because they might be with an employer or an association, and they don't need Part B, the association's product or the employer's product or the retiree's product includes the Part B. The company builds, with an insurance company, they create a product. So some people will have the A, but you have to have A and B by the time you go into an individual Medicare insurance. See, so you got to have the A and the B. You might not have the B, but you have to get it. And both A and B address acute care. When it was created in 1965, Medicare was focused on helping with acute care issues. Okay, just something that they've stuck with. So here are the two solutions for individuals. Mind you, we're now transitioned from the company as an employee. We're outside of a retiree plan. We're outside of an association. We're now on our own, and we have to, get the right insurance. So we have original Medicare solution, and we have the Medicare Advantage solution, and I reference it to the TV's Medicare Advantage solution because we're inundated with that story. And so, but this is critical. The next point, Medicare Parts A and B are absolutely foundational in the original Medicare solution. They're absolutely foundational. We go over to the Medicare Advantage solution, and they are supposed to be foundational. So I'll develop that at some point. Okay, so Part A, just to be a little more specific, it's inpatient, and it's when you're in the hospital as an inpatient, when you then might transfer to a skilled nursing facility, when you might come home. There is some home care associated with that hospitalization, rehabilitation period. There is some home care included, and there's blood transfusions if you need it. There's 3 pints of blood, I think, is what it is. B is outpatient. A lot of people don't understand the differences. So Part B is outpatient. So we call the ambulance, that's outpatient. We go to the emergency room, that's outpatient. We then, have some doctor visit follow-ups. We have imaging, MRIs, x-rays, things like that. That's outpatient. We have outpatient surgery, same-day surgery. We have urgent care. So anything outside of being an inpatient is truly Medicare Part B. So A and B are absolutely necessary. Part A is free for most of us. You're eligible for free Part A if you or your spouse, if there is a spouse, contributed the equivalent of 40 quarters annual. There's an annual 10-year requirement. You can break it down into 40 quarters. If you've satisfied that, if you've made the FICA contribution for 40 quarters, Medicare is free. Or if your spouse did it and you didn't, it's really, really very generous of Medicare. Part A is free for most of us. Part B has a monthly premium, which we all have to pay. And it does vary with income, but for most of us, it's $164.90 a month in 2023. That's the starting point. Can be higher based on, someone, having significant income, a couple having significant income, or an individual having significant income. But most of us are going to be at $164.90. That represents a come down, unfortunately, a savings from 2022 to 2023. This current year, we've been paying $170.50, and it's going to go down to $164.90. Okay. CMS and many of us have identified what constitutes top quality of care when selecting a Medicare solution. And here's my 5 listing. It's not me, but it's what we're learning. Who would question that you'd want unrestricted nationwide availability of top docs, not just any doc, not the JVs, the junior varsity. We want the top docs. We want top specialists and 5-star hospitals. So this is indisputed that would be the top of the list. Unrestricted nationwide availability, because we go to Florida, we go to the Jersey Shore, we could go anywhere in the US, we go to Hawaii, we can go anywhere and we would still want access. Okay, so that's the first point. The second point is no referrals for doctors or specialist visits. Highly desirable. Multiple second opinions without referrals. Highly desirable. Certainly if you're trying to trace down a diagnosis, you're seriously sick and there are conflicting opinions. The big one is it Parkinson's? Is it, that's a tough one. It looks like severe I'm trying to remember some other autoimmune issues. I mean, so you need to go to other specialists, perhaps. I'm not a doctor. The portability of the plan throughout the USA. As I mentioned, we travel, we vacation. Now you can go to emergency care and you want to be able to do that, and you can do that, and with all plans, you can go to emergency care, but non-scheduled, non-emergency care is what you'd also like. If you're going to be in Florida for 3 months, you don't want to be limited to just emergency care. You might learn there's a good doctor that you should be seeing. You might have an issue, an acute issue. And lastly, you'd like it to be automatically renewed year to year, guaranteed, for the same doctors, the same specialists, in the same hospitals. So that's quite a wish list. I have a list that's another 5 points, but I think this is enough. I don't think there'd be any pushback on these points. So let's go back to the 2 solutions. On the left, on my left anyhow, original Medicare, A and B are absolutely foundational. Medicare is primary. That's the big point. Medicare is the primary. If I go to my other side here, the Medicare Advantage solution, the A and the B are supposed to be foundational, and we'll get to that. But the private insurer is primary, not Medicare. So the Aetna or the Cigna or the Humana, you name it, they're the primary, not Medicare. Now, what does that bring on? Well, back to the left, CMS, that's the Center for Medicare and Medicaid, they explicitly define the A and the B benefits for all insurers. So Medicare is primary, and Medicare is defining the A and B benefits for all insurers, meaning there is no wiggle room as to benefits eligibility. Coming back to the other side, the Medicare Advantage solution side, each private insurer defines its own A and B benefit rules. They're charged with providing the A and the B, the equivalent, but they interpret these rules from the Medicare rules. They interpret them and roll their own set of benefits. And what happens is you have a significant amount of wiggle room as to what the benefits are under a Medicare Advantage solution. And it leads to frequent claim denials. And very upsetting, especially if you're really sick and you're dealing with a denial and you've got to appeal. That's the last thing you want to be involved in, using your energy pursuing an appeal. So that's a little more of the picture on quality. Personally, I'm a big fan of original Medicare solution, and I'm not a big fan of the Medicare Advantage. And for these reasons, I think it's warranted, the reasons. Now, just 10 days ago, the Philadelphia Inquirer had a big splash. Medicare Advantage plans, actually, this is being obscured somewhat, are basically telling people they have to go home sooner. I'll just develop that point. Healthcare providers, nursing home representatives, and advocates for residents say Medicare Advantage plans, the HMO PPO type plan, are increasingly ending members' coverage for nursing home and rehabilitation services before patients are healthy enough to go home. And that's due to this rolling their own rules. They're supposed to be, living up to A and B rules, but they roll their own and they get away with it. And so they wind up with disputes, and here patients are being sent home before they're ready to go home. This same article, Medicare Advantage coverage sometimes dictates less overnight stay time than traditional original Medicare would authorize. And that's the fact. In traditional original Medicare, the medical professionals at the facility decide when someone is safe to go home based on Medicare guidelines. In Medicare Advantage plans, the plan decides. So this is where I'm not happy with that arrangement of the Medicare Advantage people, those companies rolling their own. Now let's just talk for a moment about, where are we right now? We're in the annual enrollment period. It started on October 15th. So it has started and it will end on 12/7, December 7th. So if you currently have, what can you do? If you currently have a Medicare Advantage plan, that's in 2022, you're there with the plan, Medicare Advantage, you can switch to Original Medicare as your primary insurer for 2023. And most people would add a Medicare supplement plan and a Medicare Part D drug plan. What else can you do? If you currently have a Medicare Advantage plan, you can change to a different one. Okay, you can change to a Medicare Advantage plan with another private insurer. So you're still in the Medicare Advantage world and you're changing plans within that world. You're not going back to Original Medicare. You're just staying in the Medicare Advantage lane and you're just going to another private insurer. Also, if you have a Medicare Part D prescription drug plan, and you would have one, if you have a Medicare supplement, you most likely would have this. You could conceivably have this if you also had a Medicare Advantage plan that didn't have prescription drug coverage. So they could be two separate pieces. So if you have a Medicare Part D prescription drug plan, tongue twister, you can change to a Medicare Part D prescription drug plan with another private insurer. There are 25 such private insurers on the Medicare Part D. And so, if the one you're with you're not happy with them, you can change to another one. And that's a process in itself. It's easily done, but it's a process. So let's come back and recap Original Medicare Solution, or actually some highlights. Started in 1965. This is what is a wow for me. Medicare has a national USA network, 718,000 Medicare doctors and specialists. So out of those 718,000, that's going to be, you're going to find your preferred doctor, your preferred specialist. They're there. If they're anywhere, that's where they are. They're in a Medicare, they're Medicare, they opt into Medicare. They're Medicare, they accept Medicare. They're Medicare providers. And at the same time, this network has 6,023 Medicare hospitals, 407 are 5-star, and I'll point out why that's important. 1,136 are 4-star, and the rest are 3 and 2-star. There are 60 companies, 60 plus, competing. These are private insurance companies competing for your Medicare supplement business, or it's also known as Medigap. So Medicare supplement, Medigap are one and the same. And there are 60 plus, maybe 61, 62, it varies year to year, that are offering the Medicare supplement product that are specifically CMS defined. The Center for Medicare has defined and mandated the benefits. So there's no wiggle room. So of all 60, they absolutely have to offer the exact same defined and mandated benefits, no rolling their own. And then there are 25 competing drug plans that are customized to your specific set of drugs. So this is where you're being fitted into exactly what you need. And I like it a lot. Okay, now let's go over to the TV Medicare Advantage solution. TV, is again, it's what you turn on the television and you're going to get an ad about every 30 minutes or more. Okay, so what do we have? We have the private insurer is primary, and their interpretation of CMS rules is what you get as their benefits. These plans roll their own rules on benefits, causing great confusion and frequent claim denials. If you remember, the Original Medicare Solution has this national network, but these Medicare Advantage plans, this is the picture, they're limited local networks. And a broad network, instead of 718,000 doctors as the Medicare Solution has, the Original Medicare, this would be considered a broad local network, having 2,748 doctors and 48 hospitals. And that's usually going to be close to what you need, I have to admit. But Then there are some networks that are only medium in size, 1,300 doctors. Now this has, out of those 13, there are 16 specialists, specialty types that seniors use, cardiology, cancer, and on down the list. There are 16 different specialties. So you have to, in this 1,300 doctors on the medium sized network, you've got to find all those specialists plus your primaries. You go to a small network, and some of these networks are small from these Medicare Advantage products. You have only 516 doctors and 13 hospitals. To me, you know they're not going to be the 16 specialists that you would need. So you'll go to a PPO, which we'll get to. Okay, and as for these Medicare Advantage products, the drug coverage is optional, but if you go for it, it's captive. They don't customize, they don't match up your unique drug needs to the plan. You get one plan, you pick a Medicare Advantage plan, and you get their one and only drug coverage. So it's not it is captive and it's not customized. So I don't like that. All right, so another way of looking at original Medicare solution, we have original Medicare as our primary down at the bottom. That's the foundation, A and B. We have the supplement product, Medicare supplement in the middle. They're coming from 60 different competing insurers with identical plans by CMS. And then on top, we have the 25 competing drug plans. So yes, you can keep your doctor with 718,000 Medicare doctors and specialists in the national network. You really can. And that's, to me, where you ought to be. Now, I contrast that with the Medicare Advantage PPO solution. The PPO, I perhaps should have described first, but the PPO allows you to go out of network. It's a step up from an HMO, a health maintenance organization. These are both Medicare Advantage products. So because of those network constraints, trying to find specialists, I feel most people that would go to a Medicare Advantage plan would go to the PPO solution. It's still $0 a month, most of them. So you're not going to pay any more premium. So what do we have in Pennsylvania? In this zip code 19380, there are 6 different private companies selling a combination of 10, all different. Every single one is significantly different in their benefits, support. That's because they roll their own, and they're primary. In this case, the company is primary, not Medicare. And on top, you have an option plan that's captive with no competition. So there's no customization. And this little cherry on the top is probably the most challenging. They say, call now. Maybe the plan has a hospital. You have to call and find out. Maybe your doctor is in the plan. Maybe your hospital is in the plan. Maybe the out-of-network specialist will accept the PPO reimbursement. This is a biggie. Just because you can go out of network, specialist doesn't have to accept the PPO reimbursement, and you're out 100%. The doctor's bill will be something for you to pay 100% if the specialist chooses not to accept the PPO. He doesn't have. Maybe the premium is 0. A lot of them are, but there are others that are not. Some of the companies, like I won't mention. I should mention the company, but you have a mix of zeros and $60, $80, $100 per month. There are premiums, but you can find a $0 premium plan. Maybe your drug is covered, maybe it is not. Maybe you'll qualify for the Part B give back. They're making a big deal out of this. They're saying, call now, make sure, see if your zip code will cover $50. We'll give back towards your Part B premium. If you remember, the premium was $164.90 if and you get $50 of that back. Well, there are, out of 36 Medicare Advantage plans in our zip code, 4 of them, 4 out of 36, give back the $50. $50, not 100, not, not 164, but big deal, $50. Now we'll put that in perspective a little later. Maybe the quality of care is 5 stars. Maybe dental, vision, and hearing are covered. So we'll add some hearing, some airing. More on quality. The network, I think, is a big concern. So in the first line item, we've got the original Medicare, the entire say that's our network, 718,000 doctors. What's your chance of a best outcome? Absolutely. There couldn't be any better. You have access to second opinions, multiple specialists, and the top docs. That's where they are. They're going to be in this Medicare network. But we go down to the Medicare Advantage networks, the broad, the medium, and the small. They're the next 3 lines. Just the numbers, the sheer numbers, which the outcomes are going to be less likely, lesser likely, and least likely. That's just statistics. You can't get away from it. Okay, so the path to best outcomes is the original Medicare product, not the Medicare Advantage product. More on that quality of the networks. Now we're talking hospitals. Again, the original Medicare network, which is the entire USA, you're going to absolutely get the best outcomes. There are 6,023 hospitals. Wherever you might be, you're going to be able to find one. 407 5-star, 1136 4-star. And then when we get to the Medicare Advantage, broad, medium, and small, you'll see how many fewer hospitals, 5-star, 4-star, there are. So if you value your life, your health, your family, I think it calls for being in the original Medicare picture solution. So again, their star ratings for the 10 Medicare Advantage plans that are in our zip code. They rate them all. And a 5-star rating represents excellent performance in patient care. That's the top of the chart. A 5-star rating. None of the 10 Medicare Advantage PPO plans are rated 5 stars. They start at 3. Actually, they start with none of these 10. One of them has no stars yet because it's new this year. So that's fair that they don't know. We don't know. They don't have a track record. Then the next one up is a 3, and then there are 4 and 4.5, but there are no 5s. And that's what you want. Okay, so much for quality of care. Now let's talk about cost. So if you were to age 65 female and married, and you said, let's go with original Medicare with Plan G supplement. That's the Plan G it's the supplement that I'd say half the people go for. Plan G is really nice. There are no copays or deductibles after a very minimum deductible, which I'll show you. No copays for doctor visits, specialists, for anything after you satisfy a small deductibles. So here's the worst case scenario on financial exposure for someone with a chronic medical condition or conditions. So we're looking at 12 months of premium, $112.05 a month, $1,344.60. This is that minimum Part B deductible. That is it. You satisfy that, and there are no copays or for anything. Okay, so 226 to the 1344, and we lost our internet connection. Is back, I guess. I hope. And then we add in the drug plan. The lowest premium drug plan 2023 is a $5.20 plan. It's a good plan. So those numbers, the 6240, the 226, and the 1344, this is the absolute maximum total that someone with a original Medicare and a Plan G supplement and a drug plan, this is their maximum total annual cost, $1,633. I'm not counting any pharmacy copays. Oftentimes they're minimal, but this would be independent of the copays at the pharmacy, and that would be true of a Medicare Advantage plan as well. So we have a maximum total. This is it. You can't spend any more. You can't get anything more than 1633. And so a budget, and you could have a true budget in mind. It's 136.08 per month, and that's it. You can budget it, and that's on an annual basis. Get to a monthly budget, it comes to 136.08. So let's look at your maximum financial exposure if you had a Medicare Advantage plan, a PPO. Okay, this is someone with chronic medical conditions. So this looks good right up front. 12 months of premium at zero is zero. But this PPO, of the 10, this is the top. It has a cost sharing maximum of $12,250. You have to spend the $12,250 before the plan 100%. So you're out of a copay for almost everything you do, the ambulance, the ER, everything, doctors, hospitalizations, skilled nursing. They're going to get you for the $12,250. You're really sick. I mean, there's a good chance of it that you'll, incur these costs. So just a worst case picture, maximum total annual cost could be $12,250. And I call it a pseudo budget, $1,020.83. You take the $12,250 and divide by 12 months, and there's $1,020.83 per month. So comparing the two, Medicare with a Plan G versus a Medicare Advantage PPO, we're looking at $1,633 for the original Medicare maximum total annual cost. And on the Medicare Advantage side, we're looking at $12,250. So budget on the one side, the original Medicare side, is $138.66 a month, $138.66 per month, whereas the Medicare Advantage budget on a monthly basis would be $1,041.66 a month. I mean, that's like about $960 more per month. And I make the point again, if you're out of network, on the Medicare Advantage side, if you have to go out of network, that provider can decline the reimbursement and the cost will be 100%. So I had mentioned, I built this to show you how the 65-year-old female would fare. But on the original Medicare side with the Plan G, premiums increased by attained age. And so the 75-year-old, the numbers look like $1937.38. That would be your annual maximum total. And that budgets out at $161.44. The 85-year-old person, that annual total max is $2,742.24. And that budgets out at $228.52, $228.52 a month. You go over to the Medicare Advantage side, and any age, male or female, married or single, that $12,250 maximum is still there for any age with a chronic condition, with multiple chronic conditions, or even a single. You can't get away from the $12,250, and the budget is $1,020.83. So in all ages, you're better off on the original Medicare side. And we covered the quality. There was so much more quality in the availability of the network providers and actual adherence to the benefits. This is where I define the HMO and PPO. I should have done it earlier. An HMO, these are Medicare Advantage solutions. The two popular ones, HMO, Health Maintenance Organization, and the HMO member pays 100% if they go out of network. So you must use in-network providers if you're in an HMO. You must use them if you want to go reimbursement plan. If you go outside of their reimbursement plan, out of network, you're going to pay 100% of that provider's charge, the provider you pick. The PPO is a preferred organization, and you can use out-of-network providers, and you'll typically pay up to 40% of the provider's service charges, and that's providing they accept the reimbursement, which, you know, would be, you're going to pay up to. And if you go out of net, if he doesn't accept the reimbursement, you're looking at 100%. So now, putting some things in perspective, how can a personal cost sharing responsibility, a cost sharing personal responsibility of $12,250 or $1,020.83 a month, how can you justify that? If a $50 a month is a $50 per month give back benefit worth putting yourself to that possible exposure of $1,020.83 a month? I mean, you know, why? It's not worth it. It's not even, you know, big deal. You get $50 a month back and you're set up to be paying $1,020 a month. Only, as I mentioned earlier, only 4 of the 36 Medicare Advantage plans have the give back lure. I'll call that the lure or the bait. You know, you don't fall for it. Okay. Is the extra hearing benefit worth putting yourself at risk of $1,020.83 a month? You know, it isn't. The typical extra hearing benefit is no coverage of the hearing aids, a $35 copay for hearing exam, and you can get that out of original Medicare. So there's, you know, that's a wash. And big deal, a free hearing aid fitting, but no coverage for the hearing aids. That's typical. That's the typical. You know, there are 36 plans. You have to drill down through all of the 36 to find something different than what I'm putting forward here. This is the typical. Okay, again, more of the question, how can you justify it? The extra vision benefit, the typical extra vision benefit is no coverage for lenses, frames, and upgrades, no coverage. A free routine eye exam, which is covered by Medicare if you have the right diagnosis. If you have macular degeneration, glaucoma, retinopathy, or cataracts, you can get your eye exam covered by Medicare. So, you know, these 2 points are so what? No coverage for lenses, frames, and upgrades. C, well, I don't even have a C. So how about the extra dental benefit? Is it worth paying, you know, putting yourself in this situation of having to pay $1,020.83 a month? Now, this is where you'd say, okay, we're going to get $500 max per year on the dental side. But again, is $500 getting that worth putting yourself, you know, at risk of $1,020 a month? You know, it doesn't make sense. And what are the benefits? If you're in network, you'll get a free cleaning and a free exam and x-rays, fine. If you go out of network, and most of us for dental seem to go out of network. I mean, our dentists tend not to be in networks, the ones that we would want, you know, yeah. So if you go out of network, it's 50% co-insurance. And other services, you know, the more expensive services, endodontics, periodontics, extractions, 50% of those, you pay 50% of the contract price in network, 70% out. So, I mean, this might be the one most attractive, but it certainly isn't worth $1,020.83 a month, putting yourself in that bind. So here's an article out of the Inquirer about a year ago, and it says, today's TV Medicare advertisements have it backwards. So what was the message? The 24/7 TV Medicare Advantage ads are designed to first highlight the maybe you will qualify for supposedly free non-Medicare extras. along with the misleading $0 per month premium, while hiding the gigantic $12,250 personal cost sharing responsibility. That's the sum of the Inquirer article. Forbes ran an article called Half Truths and Medicare Advantage TV Commercials. And this first point is, in watching several different Medicare Advantage commercials, there was much left unsaid, which is the important information you need to make a smart decision. So that's true. They hide the out-of-pocket max information. They hide the deductible information. And this is part of that Forbes article. Keep in mind that these Medicare Advantage plans are offered by for-product entities and corporations, and they are. The purpose of the TV commercials is to get you to act, to call the number on your screen, to make you purchase. The commercials focus on zero premium plans and non-Medicare benefits available for no added cost. However, the small type on the bottom of the screen reads, co-payments and co-insurance can apply, and non-Medicare benefits may not be available in your zip code. And more of the same. I'll just, okay, more of the same. So I like this last comment. The Advantage, they're called Medicare Advantage plans. The Advantage belongs to the private insurance company, not to the member. So a reality check. Nationally, this is a national number, 60% of eligible seniors, eligible Medicare seniors, choose the original Medicare solution. That's 60% nationally. Now, this is my educated guess. 95% of Hershey's Mill seniors choose the original Medicare solution because they're a bit older, median age being 75, and a lot smarter. I do believe that. They are able to recognize that all of the quality of care requirements are in place, and the total annual cost exposure is lowest with the original Medicare solution. And this is interesting, I think. Buyer's remorse, we know what that's all about, and the accommodation for buyer's remorse. Okay, Medicare created the Medicare Advantage disenrollment period. Okay, get that? The Medicare Advantage disenrollment period years ago. For years, the Medicare Advantage disenrollment period, I see a typo here, this should be MADP, ran from January 1 to February 14th. So add at Medicare Advantage, not Medicare disenrollment, Medicare Advantage disenrollment period, okay? In 2020, the Medicare Advantage disenrollment period was renamed the Medicare Advantage open enrollment period and was extended to 3/31. But again, all this is about buyer's remorse. You've bought in this enrollment period of October 15th to December 7th, you've made a decision and bought a Medicare Advantage plan. Now they're saying you'll have from January 1 to March 31 to disenroll, because whatever, you got smart, or you got somebody helped you understand, the potential problem. And the main purpose of this renamed MADP, renamed to MAOEP, is that an enrolled Medicare Advantage member could switch to traditional Medicare, original Medicare, and add a supplement and add a drug plan. Okay. That's, buyer's remorse. They recognized it years and years ago that somehow you might get some wisdom or see the light, and you didn't want to be in a Medicare Advantage plan going into the new year. So they created the Medicare Advantage disenrollment period, renamed it, and now you'll have January 1 to March 31 to get out. If you're in, you have those 3 months to go back to original Medicare. So this, just to highlight again, what is this MAOEP? Medicare Advantage enrollees can switch to original Medicare, or they can go to a different Medicare Advantage plan. That's important. You can get out of one Medicare Advantage plan and go to another. The ability to switch is limited to one plan change per year at this time. This one, January 1 to March 31. Right now in 10/15 through 12/7, you could actually make multiple enrollments. You could say, you know what, I'm not going to, I thought I liked that plan. I don't. I learned something about another plan. You can make multiple enrollment changes from 10/15 to 12/7. But once you get into the January 1 to March 31 period, there's only one change you can make. And so be careful. And then just a little bit on the drug plans. How do they work? There are 25 plans for our zip code 19380. They all end on 12/31 of each year. So if you are
Did
in,
not make any noise this entire time until I unmuted.
I'm almost finished. What are you saying? I'm sorry.
Oh, I'm so sorry, Joe. My apologies.
Okay, I'm almost finished. Okay, so as to these drug plans, these standalone Medicare Part D drug plans, there are 25 in right for 2023 going forward. The one you have, if you have one, will end automatically on December 31st of this year. And we know we get letters, change notices, notice of change, I think they're called. Formularies change, prices change. That's important. And so those formularies could be changing, the list of covered drugs could be changing, but they must include all the drugs that are recognized by CMS in a category. That's you know, these are all good plans. I'm not sure the premium is good, but the quality of the formularies are good and they're extensive. You'll pay a monthly premium directly to the plan. So the lowest plan premium in 2023 is $5.20 per month, and it has a $505 annual deductible. You pay deductibles and co-payments to the pharmacy as you have drugs filled, or you might pay it to the mail order part of the plan if you're using their mail order service, and they'll generally want your credit card. And so their co-pays will and deductibles will go against your credit card. And some of the thresholds. The annual deductible maximum of these 25 plans is $505. Some charge no deductible, and then there's a range. There's a couple with 100, couple with say 350, but they cannot charge more than $505 in the annual deductible. The initial coverage amount, this is the amount before you go into the donut hole. People call it the donut hole. We know what that means. When you and the company together spend $4,660, that's a lot. You know, your part might be 600, 700 of that, and the company's paying the difference. But when that number, they track your totals, and when it gets to 4,660, you go into the donut hole. And what that means is the company's not participating in paying the copay or any more deductible. You're in the donut hole, and you stay there till the list price of the drugs you would be filling come to $2,740. Good news is you won't pay that much. They're going to track the list price, but you're going to get a 75% discount from the manufacturer. So you'll be paying 25% of that $2,740, but they'll count the $2,740. So you then exit from the donut hole at $7,400. And then you really get some nice rates for the rest of the time. Let's say you come out of the donut hole, excuse me, in September of 2023. So the next 3 months, you'll get your generics, any generic drug for $4.15 for a 30-day supply, $4.15. And any brand, it could be, a brand that would otherwise cost thousands of dollars. You're going to get the brand for $10.35 for a 30-day supply. So the rates are very helpful. They recognize that you've been through a lot. So that's that picture. And that's the end. And so some valuable resources. The 1-800-Medicare is their line. Medicare.gov is a wonderful website. Medicare and You, the 2023 handbook is really an excellent bulletin. I'm there, and there's my phone and my email. And as Sherry said, happy to talk to anybody that wants to, chat about, what's best for them. That's all for now. Thanks for participating. And I'm
I've
available for questions. Yes, Sherry?
Sorry, Joe, I didn't mean, I thought you were done.
I am.
I've just asked everyone to unmute.